Anyway, let's get to other issues. Dr. Tony O'Sullivan joins us. He's co-chair of Keep Our NHS Public and joins us now. Good morning to you.
Hello again.
Hello. I was wondering, do we need to have an organisation called Keep Our NHS Public? Now you've got a Labour government and those awful Tories are out who wanted to privatise the NHS.
I think you probably know the answer to that. At the moment, Keir Starmer and Wes Streeting are promising to use the private sector more effectively than the Tories in order to address the waiting list, and that's ludicrous, really, in my view, and Keep Our NHS Public's view, because we know that every pound spent on the private sector actually, to some degree, undermines the NHS because the private sector relies on NHS staff, and
yes,
you know, your mother's a GP. It takes staff away from NHS shifts to staff the empty private theatres and outpatient clinics, so that's where they get the extra capacity from. They get the extra capacity from.
And everyone's trained by the public, at our universities.
Yes, it's still an issue, Julia. It's still very much an issue.
Okay,
yeah.
All right. So you still need to exist. What do you make of the junior doctors, now called resident doctors, as from today? I think a lot of people seem to think, including a former health secretary, Victoria Atkins, that people who were working often 8 to 10 years as junior doctors were still training. No, they're not. They're now going to be known as resident doctors. But junior doctors have voted to accept a 22% pay rise over 2 years. That was agreed on behalf of the BMA with the new Health Secretary Wes Streeting. They said, though, that that's not necessarily the end of the strikes. They are still, I think they claim 20% under where they would have been if they'd kept pace with inflation from 2010. Do you support that pay rise for junior doctors?
Well, thinking of patients' interests first and foremost, and then the interests of the staff that serve them in the NHS, I'm very pleased that the dispute has been resolved for the time being, and I hope that the conversation continues between NHS staff, not just doctors, but other staff and the government.
Yeah, everyone wants a conversation. Do you think that was the right pay rise? Do you think they were right to be offered it, right to accept it?
Well, as you know, I'm not a union negotiator. I'm pleased that they've accepted that. It's
you're my money paying for it.
Yeah, me too. It's a step in the right direction.
They should get more.
And as you've just said, it doesn't restore the pay levels that the NHS staff across, 1.5 million. Sorry.
Oh no! Don't. Eventually, it will be 1.5 billion working in the NHS. I'm sure at some point.
Well, we
are a nation. We are an NHS attached to a nation, after all.
Anyway, let's get back to serious questions and solutions. I think
the question of junior doctors' pay is serious.
Oh yeah, and I've answered that.
Yeah,
I think I'm pleased. I'm pleased they got the pay rise to the degree that they're satisfied.
What do you make of GPs slashing their hours by more than 10%, according to the latest study? Working an average of they worked an average of 26 hours a week in 2022, down from 30 hours in 2015. This includes part-time GPs, but not overtime hours. There's been a drop in the number of appointments and the actual number of patients they're seeing, even though we've got more people in need of healthcare. Obviously, older people often take longer appointments, but also lots more comorbidities, but also that we've got more people on the waiting list, and more patients per GP surgery as well. Isn't part of the problem that GPs, the gateway to NHS services, don't work long and hard enough?
Oh well, I hope your mum's listening to you.
And she'd agree with me.
That you're right at some point, but you know very well.
No, she agrees with me. She doesn't understand how anyone could work as a part-time GP in our surgery.
Let you both listen to a couple of things, if I have to say that the GP staffing has gone down 1,700 in the last few years instead of the promised extra. You know that the numbers of patients per GP has gone up by 300 in the last few years. You know the pressure of work's gone up. So I would say that... I don't know
the pressure of work has gone up. No, that's what they claim.
If doctors are actually deciding to take less hours, first of all, that's up to them, and as in any workforce. But
it has an impact.
I would say that as a symptom of the distress.
Or it's a symptom of the fact they got a big pay rise some years back and now can afford to work a 3-day week when they previously couldn't work a 3-day week.
Well, we frequently exchange views, and sometimes we even disagree, or occasionally we do agree. But you know that Lord Darzi, who isn't a member of Keep Our NHS Public, went into this in great detail over the last few weeks and reported last week. And his conclusion was that the NHS is in a state of disrepair because of a decade of neglect and underfunding. And he found that there's nothing in principle wrong with the NHS as a model, that other health systems are more expensive. And to me, that fits in with my feeling that when the NHS is funded to succeed and not underfunded to fail, it's actually the best system in the world.
It's not. Well, if it was, every other country would have followed it. And why on earth does Spain, that doesn't have an NHS system like ours, why does Spain spend less money than us and have better health outcomes?
Well, you probably know that most advanced countries in the world have actually mimicked to one degree or another.
No, they have. No, they've still got social insurance systems. They haven't got one big monolithic organisation.
Yeah.
They've literally not got the NHS the same way as we have.
Yeah, the other big story, which I thought you were going to ask me about, was the numbers of people out of work.
Yeah, we've got 1 more minute, so get to that very quickly then.
Yeah, well, I think that's also raised in the Darzi report that because of the disrepair of the NHS, and he did put it down to austerity, although I'm sure you agree with that. That is the reason that we performed so badly in Britain during COVID, and that is why over 800...
No, it wasn't. There were political choices. That's absolute nonsense.
Just let me finish this sentence. 800,000 people were added to the out-of-work list. It's nearly 3 million.
But that's not because of underfunding of NHS. There's simply no evidence to make that claim whatsoever. There really, really isn't. The reason we performed so badly during COVID was because of political decision-making at the top of government and the top of the NHS to close down our service to anything but COVID. No other country did that. That's why we're in the mess we're in. This is Talk, the home of common sense.